Wallonia is a region where people think about the future.
Where they know that innovation is key to develop companies.
While respecting sustainable development.
Today, Walloon industries are present in a large part of the world.
And provide solutions in all fields on the
providing talented solutions in all business segments.
Moving forward
is imagining and creating
the world of tomorrow.
Wallonia is a region where people think about the future.
Where they know that innovation is key to develop companies.
While respecting sustainable development.
Today, Walloon industries are present in a large part of the world.
And provide solutions in all fields on the 5 continents.
They're developed based on the creativity,
commitment and reliability of their managers.
Wallonia is not a large region in terms of size.
It is large in its extent of its innovation.
That is the key of its development.
The future of Wallonia is linked to its international development.
Providing talented solutions in all business segments.
Moving forward
is imagining and creating
the world of tomorrow.
Wallonia is a region where people think about the future.
where they know that innovation is key to develop companies.
while respecting sustainable development.
Today, Walloon industries are present in a large part of the world.
And provide solutions in all fields on the 5 continents.
They're developed based on the creativity,
commitment and reliability of their managers.
Wallonia is not a large region in terms of size.
It is large in its extent of its innovation.
That is the key of its development.
The future of Wallonia is linked to its international development.
Providing talented solutions in all business segments.
Moving forward
Is imagining and creating
The world of tomorrow.
Wallonia is a region where people think about the future.
Where they know that innovation is key to develop companies.
While respecting sustainable development.
Today, Walloon industries are present in a large part of the world.
And provide solutions in all fields on the 5 continents.
they're developed based on the creativity,
commitment and reliability of their managers.
Wallonia is not a large region in terms of size.
It is large in its extent of its innovation.
That is the key of its development.
The future of Wallonia is linked to its international development.
Providing talented solutions in all business segments.
Moving forward
Is imagining and creating
The world of tomorrow.
Wallonia is a region where people think about the future.
Where they know that it's key to develop companies.
Part of the world.
Hi everyone, together with me to MEDICA. This is one of the biggest international fair for medtech and life sciences. And the place is very dense, very huge, very crowded. So to guide us, I have a special guest. This much for guiding us here on MEDICA.
Hello, Julie.
For us in here. More precisely, we are here on, I say there is not only one Walloon pavilion this year on MEDICA, right?
Yes, exactly. So, World Forum for Medicine is one of the largest events for medical technology in the world, if not the largest one. Yeah. And so we have 17 halls in total. It means that there is between 5,000 and 6,000 exhibitors. So actually, and each medical technology. So we have the main pavilion here for Belgium, so including Wallonia, where we have, I think, around 15 companies from Wallonia who are here. But we also have pavilions in the diagnostics hall and in the technology, I would say, hall. It's called Compamed. It's all about the technology and specialized services for medicine.
So why choosing to having that many Belgian Walloon pavilions in here? Why not one big one?
Yeah, that's a good question. So already here, you can, as we will see while we will walk around, it's quite a big pavilion. And actually, we are working with Flanders and Brussels in order to come with a large Belgian pavilion, because it's so huge, this event, that we have to come with a critical mass. Yeah. If we want to offer a better visibility, exactly. But then at the same time, the right companies in the right hall, where they can meet directly the potential customers.
Oh, great. So there's. So on today's program, we will visit 6 or 7 companies of the year, and they are busy. They are specialized in different sectors, in different how to say. They have different fields of activities. Huh?
Yeah, but you know, the medical technology sector is very diversified. Mm-hmm. It's diversified in terms of technology. It's diversified in terms of medical applications. Mm-hmm. So. And the fact that there's a lot of innovation happening in Belgium, Wallonia, it also means that we have a very large selection of companies that are present here at the event.
I don't want to say, but actually we're just close to the French pavilion, but actually my impression is that there are more companies here on the Walloon pavilion than on the French pavilion. So is it also one of the reasons that we called Wallonia the medtech valley?
I wouldn't say medtech valley, but rather the life sciences valley. Or as the Belgian federal government they are launching an initiative called Belgium, the health and biotech valley of today and tomorrow. Because
Why that?
Because we are very strong also in pharma and biotech. Mm-hmm. So if we take the whole life sciences health industry in Wallonia, it's 400 companies. Okay. So actually it's a much larger density than Germany or France, or on a quite small territory. We have many companies, and actually for Wallonia it represents 30-35% of the total export of the Walloon region. So actually we're one of the leaders in terms of production in pharma biotech. But we have also medical technology. We have in Wallonia quite strong history in engineering, so manufacturing, electronics, new materials. And we also have very good, excellent academic research. And all this can be used by startups in order to come with new innovation in order to meet the medical needs.
Okay, so I think that during this video we will also take this opportunity to discuss further about this sector in particular. But I suggest that we start the visit of the company. But I need you, because I'm not professional in this sector, so I really need your insight. Okay, let's go. Of course, if the companies, they are busy, we will not come to them and visit others. I will check first of all if maybe ECOSTERYL or Pinga is no, they are busy. Okay, let's. Okay. Hi.
Hi, hello.
Hello. So actually we are live, and can I interrupt you for 5 minutes? I just want to understand better what ECOSTERYL is doing, because I heard that you were like a world leader in your sector. So can you explain a bit about your company?
Sure, of course. So we are a Belgian manufacturer. Mm-hmm. We've been in business for more than 75 years, and we currently develop and manufacture machines to treat, decontaminate and recycle medical waste.
Is it this machine?
Yeah, it's the one that you see in the picture.
Can we have a look, maybe a closer look to the machine? Can you explain how it works?
Absolutely. So this is a patent technology we developed over the last 20 years. And, well, we basically have an input with all kind of waste generated by hospitals. Okay. It can be needles, it can be also
like this, for instance?
Masks. Yeah, everything that can come up from an operating room. So this is considered as highly infectious and very risky waste. Mm-hmm. It also comes in high volumes, so it's a big problem for hospitals, for the healthcare of the people and for the environment. So after it's loaded in the machine, it's going into a very powerful shredding process. Mm-hmm. And what we do afterwards is we infuse microwaves, and that's the innovation that we bring in the system. We only use electricity to achieve 100% decontamination. So then the product comes out in a shape that looks like this. It's like a shredded confetti.
Okay.
And after being sterile waste, we are the only ones who can actually get the plastic into a circular economy and reuse for the same purposes like the trash bins for medical waste. Okay. We are in 70 countries, more than 70 countries in the world. We export to all 5 continents, and we basically are that's what we are. We recycle medical waste.
Okay, so such a great ecological approach to the sector.
Yeah, so we touch the healthcare sector because we cope with a problem that is generated from hospitals, and also touch the environmental sector because we actually tackle to the flow streams of water, landfills, and if it's not properly treated, it can actually produce a healthcare issue.
Okay, I just have one question, because you mentioned that you sell those spectacular equipment around the world. So are you also in charge of the maintenance of the machines? How does it work?
Yeah, well, we are manufacturers and we have a very, very robust team on our technical side. So we support our customers all over the world with maintenance programs so they can, at the end, become autonomous and engage in entertaining and maintaining the equipment. So we put a lot of importance and put the right things in place to make sure that the machine works. This can be done little by transferring our knowledge in terms of maintenance. Aspects all over the world. So yeah, fantastic event.
Okay, and all around the world, what can we wish for you for this trade?
Get in contact with the current customers and potential customers of all over the world, and actually have examples today coming from Malaysia, from Qatar. I just saw a customer that wants to join. Get that connection emphasized, and I would say apart from also seeing other companies, other colleagues.
Wish you a lot of interaction, positive interaction, and potential. Much for answering our questions.
It's a big pleasure.
Okay,
Thank
great.
You so
okay, Mehdi, let's move to another company.
Hi, thank you.
I miss you.
You're very welcome.
So Mehdi, let's get to this area. I think that you would like to introduce us to another company that is also doing great in Wallonia.
Yes, actually we will meet many very interesting companies. Let's just make sure that they are available.
Okay. Is it possible to switch? No. Okay. Then.
Yeah,
which one?
As you can see, there's
really
a lot
busy,
of there's a lot of activity
really,
going on
busy.
in this.
This is something good actually to have this Walloon pavilion very crowded. Okay, so this is the company UV Mastercare. Hello.
Morning.
Nice to meet you.
Nice to meet you.
So here we will talk about disinfection, right? Can you explain to us what is UV Mastercare doing?
So we are based in Belgium, close to Liège, close to the university, and
Great
we
idea.
we are manufacturing some medical. It's not a medical device; it's a device that disinfects air and surfaces.
How does it work?
So it's based on UVC technology. Okay. So the UV will destroy one of the protein that it's in the DNA or the RNA of the cell and make the cell impossible to reproduce.
Okay, so it killed the virus and...
Virus, bacteria, and fungi also.
Okay.
Yes. So it's without any chemicals. It's just the natural light.
Okay, that's the magic of this company. It's treating the surfaces without any chemicals, right?
That's correct. Yes, okay. And it's a process that's very fast. So you will disinfect 20 square meters in 4 minutes.
Oh wow!
Which is very efficient and fast. Yes.
So your technology can be applied in hospitals, also for the elderly care homes?
That's correct. We are active in a hospital, in biology laboratories, like an R&D lab, and also in elderly houses, but also in, I forgot how to say that in English, in confectionery business, like food business, manufacturing, yes, yeah.
Okay, and so you have here some equipment. I see this one actually.
Yes. So
and how does it work?
So this is the UV light. So you position this device inside of the room.
Okay.
With his slave. So that's the master and the slave, and together we put that in diagonal into the room. So it reduces the shadows. And so the spot that will not be touched by the light because of the shadow.
Okay, and so you mentioned 20 square meters, 4 minutes.
Correct.
Great. Is it your first time on MEDICA?
No, this is not our first time in MEDICA. We've been there 2 times with the product. Mm-hmm. I think it's an interesting show because it's an international show. So we have the opportunity to meet many people from different countries, and it's a good way to expose and show and share.
And so many applications, especially I would say after COVID.
Yes, COVID also was, of course, a good period for us because we were able to
Business
solve.
speaking.
Yes, we were able, correct. We were able to solve many problems related to COVID, of course. Yes.
So thank you for those explanations and also what you did to support the hospital cares and during the COVID times. We wish you the best for this international fair. Yeah. Okay, is ACTIFAR ready? No, they are still very busy. Okay, let's move to another company.
Let's continue the tour.
Yeah. So, how well is the sector, the medical sector in Wallonia?
Actually, so it's really a growing sector. As I said, thanks to the expertise that we have in engineering. Thanks also to our experience in research, in clinical research and clinical trials. Okay. So actually, maybe you don't know, but Belgium is one of the leaders in clinical trials in Europe. Okay. So we are in the top 3 in terms of number of clinical trials and at a level of expertise for advanced therapies in clinical trials that also stimulate actually the innovation in the industry. And I think that we might go this way.
I follow you.
Thank you.
So what is this company?
So Allen & Co. And I will let them explain what they do. Hello.
Hello. Good morning. Nice to meet you. So what is Allen & Co. about?
It's a company in Belgium dealing with the manufacture of cotton products for the dental and medical field. We export in about 50.
Wow.
Yes, and many in the close around countries for the medical products because it's very bulky and we have more competition. But for dental products, we export them throughout the world, including Singapore, Australia, Canada. So we don't have any limit for the dental and smaller products. But for the bulkier products, we have limits and we sell our products around in the surrounding countries.
Is it your products?
Yes, the dental cotton rolls, retraction cords, cotton pellets. We didn't take much of the dental range because we are in a medical exhibition. And for the medical, we manufacture the cotton balls, zigzag cotton wool, cotton rolls, cotton pads. So all mainly from Turkey or from Germany for the viscose. Go throughout different machines to make a semi-finished product and then the finished product with our trademark or with the customer's trademark. And our customers are only importers or distributors. We never sell to the final user.
So the dental sector, the medical sector, also cosmetic?
Cosmetic, veterinary, or some other different small sector, but then people come to us, we don't participate in other exhibition. But people from many different sectors contact us to have our cotton products, not only for the dental and medical, yes.
You correct me if I'm wrong, but I saw in the documentation that you also have this ecological approach of the product.
It's true because Belgium, so we import it from Turkey, but organic cotton for the people who want it. But it's true that the price difference hesitating about buying this range of products, and all our waste are recycled.
In this mindset, and it's very interesting products, and you are exporting that much.
Yes. For the dental products, I think now we are the only one in Europe left, and for the medical, we have competitors in Poland, in Italy, Spain. We had one in France, but he disappeared. So it's a shrinking market for the production. Are proud to be there, even if competition or even if products from far away are sometimes very difficult to compete with. But we have our place, and we've been there for more than 30 years, and we are confident about the future.
Okay, exactly, and I think that I already tested your cotton. So when I was with my dentist, so there is no
bad souvenirs, bad memories.
It's okay for those interesting information, and just would like to know what you are, because here maybe we have some companies that are watching us, and they're all 15. But can you tell us what you are really expecting from this?
To be stable ourselves and.
Okay, I would like, if it is possible, Mehdi.
Once. Yes, in fields that we didn't think we could. Okay. So I brought my boss even to talk about the possibilities. Yes, it's been very successful till now.
So we will not stay that long with you. We don't want to interrupt your business meetings, but thank you so much for your time. We wish you the best and great win-win business opportunities. Thank you so much. And Rodrigo, you are the economic counselor, so that's why I saw you and I wanted to randomly ask some question about the impression about the Walloon pavilion. So you are here also to support the Brazilian or Colombian companies here on the fair.
That's right. It's part of our mission. It's our core mission, in fact, to bring into contact Walloon companies, Belgian companies with possible buyers and importers from our countries. I'm based in Brazil, but in this case, I'm visiting also Brazilian companies, but I'm helping here Colombian companies to get in touch with Walloon companies and hoping that it could result in business deals.
Thank you so much for your job, and we wish you good luck for the rest of the day. Okay, Mehdi. Yes. So I randomly found some guests here on the Belgian pavilion, but we still have some companies to pay a visit to.
Exactly.
Which one do you suggest?
Maybe you could go that way.
Okay.
So to stay somehow in the sterilization theme, but something quite different at the same time. I'd like you to introduce you to STERYSIS.
Hi, nice to meet you.
Nice to meet you. Hi. So STERYSIS, what is it about? Mehdi gave us some very short explanation, but we really need your insight.
Yeah, STERYSIS is a manufacturer of sterilization equipment to sterilize medical devices, for the medical device industry. So the primary packed products, so not for the hospitals, but for the industry.
So you mean the laboratories?
No, not at all. So we have very huge equipment which is installed at medical device producers. For example, if you heart pacemakers or also all equipment you need for surgeries, this will be sterilized with our equipment, and we are the manufacturer of it.
Okay. And do you use a special molecule?
Yeah, we are using ethylene oxide, which is a low temperature sterilization process, and it's very used for PVC and products who cannot be sterilized with a hot process. Okay. So this is with ethylene oxide, exactly.
And you are exporting already to a lot of different countries.
Yeah, we are present in whole Europe. I mean, Germany is a very, very strong market of ours because of the language, also because STERYSIS is situated in the German-speaking part of Belgium. Mm-hmm. And we have also now our first project abroad, so out of Europe in Saudi Arabia. Okay, so great. There our team is currently on site and installing the equipment.
Oh, great. Congratulations for this new step.
Yeah.
And I'm just checking here. So we have environment protection as well and sustainability. Maybe can you share some words about this?
Mm-hmm. I mean, this is also for us and for all people very important, and because we are working with a toxic and dangerous gas, we also have to install a gas treatment solution, and we pay their attention that the gas is treated and is when it comes out of the chimney, it's environmental friendly. That's very important for us. Okay. So therefore the aspect of environmental protection. And our equipment is a long living equipment, so our people, when we install it, it's on site at our customers for 30 to 50 years. And we also offer remote services and retrofit services. This means we modernizate also the equipment if it's installed inside, and that's the aspect of sustainability.
Okay, so that means that if there is already a solution in the company, you can coach them to leverage the quality of what they have?
Yeah. This is one aspect, and also, for example, if you have equipment which is already installed for 20 years, the regulations and requirements are changing, so we not have to remove all the equipment, but parts of the equipment. And this is also something our team is doing, analyzing it, and then retrofit the equipment.
What do you expect from this fair for MEDICA?
Yeah, there are two aspects. We are meeting our clients here, so we have client meetings with our existing clients, but also to meet new people, also and hopefully deliver then also to new markets for us out of Europe.
Have you already detected some good matchmakings?
Yes, during the last days, yeah, there were some interesting conversations. Yeah.
Great. Thank you. Mehdi, do you want to add something about this particular aspect of sterilization?
No,
or she already said it all?
It's just that, as you can see, if we just take one topic, we already have different approaches and capabilities here in Belgium, Wallonia. And I think that we can do the same for other applications.
It's a great solution, also very innovative. They try to make their best to improve also the sustainability, ecological approach. So very nice, very interesting talks actually.
I think it's very important also to say that the sterilization is the last step of the production of a medical device, but it's one of the most important steps, because if a medical device is not sterile, you cannot deliver it to the hospital and not use it. So it's a very, very important step in the production chain, I would say.
So very important step in the chain, so very important to find the right partner for this.
Exactly.
So why not STERYSIS?
Yeah, exactly. I mean, also, what is very important for us, I mean, the equipment we are manufacturing has also a high price, a high budget for our customers. So it's also very important for us, and I think it's maybe also the difference between our competitors is we are chasing a long partnership with our clients. We are starting very in the beginning with them, analyzing their needs. We want to sell something, but based on their requirements. And I think this is also very, very important.
Yes, you're touching a very important point here. I believe that what of the difference with companies in Belgium, Wallonia, is actually the fact that they tend to be more open and listen more to the customers and trying to find the right solution compared to other big companies or countries. Yeah.
It's also, I think that it's also quite a great confidence in the quality if you are aiming long-term relationship with a
I mean, and this is very important because, as said, the customer is spending here a high budget and he needs a partner on his side, and this is very important. That's also why we are always saying we are not selling a product, we are selling a solution to our customer which helps him to optimize their internal processes and sterilize the medical devices.
Okay. Maybe Chen, can you show please the machine so we can have a better idea of what it really looks like?
Yeah, exactly. So this is a sterilization chamber, for example, for 16 euro pallets. Means if the door opens, you have the customer has the possibility to load pallets into the sterilization chamber in 2 rows of 8 pallets. So it's a little bit like a container, and then you have all this process equipment around, which allows the customer to sterilize their products.
Maybe a stupid question, but if the need of the customer is to have a smaller equipment, it's also possible.
Yeah, you can see this also on this picture. There's a complete different equipment, a complete different solution, and that's what I mean before. So we are designing our equipment based on the needs of the customer. For example, we have also smaller equipment, so if the customer needs a smaller size without pallets, then we can offer this too. So very in the beginning we start with them and they have to tell me, okay, which volume of products you have to sterilize and which kind of products, and then we define together the different processes.
Very last question, but I would like to know how much time does it take, for instance, with with this machine to sterilize, to complete the process?
Yeah, there's also a difference. So with this bigger equipment where we are using also 100% of ethylene oxide, these processes, depending on the product, but can take until 40 hours. The other process is, I would say, simpler and more for smaller companies to mid-sized companies, and there we are talking about 10 to 15 hours. So that's also a huge difference, and I would say they are also completely different customers. So this is more smaller companies who have their in-house sterilization, and this is more for the bigger ones who are also offering services to medical device producers. Yeah.
Okay, great. Thank you so much for those information.
Thank you.
Wish you the very best for this fair.
Thank you very much.
Bye. Mehdi is busy, no?
Yeah, sorry.
Okay, hello, nice to meet you. Okay, Mehdi, if you don't mind, no problem. I can fully understand the point, and of course we just want to increase the visibility on the companies that are located here on the Walloon pavilion, but we don't want to disturb in any way the problem. Oh la la! This name sounds very good. Pain gone.
Yes, we are pain gone.
Okay, hi. So the pain is gone with you.
Almost, yeah, instantly with most of our products. So we developed a range of TENS machines, but we've disrupted the TENS device market.
Those machines?
So traditionally, TENS machines would have, I'll show you here. So traditionally, TENS machines would have leads and pads, and you would place the pads on the skin and activate the TENS device. And TENS basically sends a signal to the brain to treat your pain. Okay. So we disrupted the market by delivering a product to the market called Pain Gone, a brand called Pain Gone, but the first product we brought to market was the TENS pen. So the TENS pen you place on the area of pain and you click the button. It's that simple. But unlike traditional TENS machines, you don't have to use it directly on the skin. It works just as effectively over clothing. So you can feel the stimulation, whether it's on your back, you can use it on your leg through jeans, and in this case you use the device for 30 to 40 clicks, which takes about a minute. Okay, and we've been successful in the launch of our products. So we have the original Pain Gone, which is for arthritic pain and joint pain. We now have an automatic version, so you don't need to click it. We have a product for migraine, which is Calm. We have a product called Flow.
My mother has this one at home.
She does, okay, yeah, well, we're fortunate we have Mithra as our ambassador for the product in France.
You can use my mother as ambassador as well.
It'd be great to get some feedback, but to be fair, we get letters from people all the time saying how good Pain Gone is and what it's done for them. The Flow is very good for lower leg problems and feet problems, boosting circulation and pain relief. But we're not
ideal. I mean, at the end of the day, after a long day at work or in the garden.
Yeah, it's good, but it's also good for pain relief. So it's not just for pain, for blood circulation. It's also good for pain relief. We as a business support our retailers and distributors with a lot of marketing material as well. So we sell directly to customers like your mother, but also you can find our products in major retailers like Crefel, Date, Boulanger, in France, for example. You can also go to Australia, into the major retailers there and find our products. And in the UK, we have pharmacists like Boots and Lloyds selling our products, and you can buy them online. But we have a range of treatments all the way from joint pain, period pain, migraine, shoulder, back pain. And all of our products are clinically proven to be effective.
Actually, on the video, we will show the name of your website. So if people are interested, they can buy online.
Yeah, they can buy online at paingone.com, and you can buy in any country in the world from that website as well. Okay. And we deliver very quickly.
Is it considered as a medical device?
Absolutely, yeah. So all of our products are clinically proven to be effective. They are a Class 2A medical device in Europe. So you have to show evidence that it is effective on the pain that you're trying to treat. And in the US, the equivalent is FDA approval. Australia, it's TGA approval. Korea, it's KFDA. And we have approvals in many countries around the world.
Okay, great. So it's clinically approved.
Exactly, yeah.
So my mother was right.
Yeah, she was right to buy it because it's an effective product.
Okay,
yeah.
great.
Absolutely.
Okay, thank you very much for this information. So pengon.com. Okay. So Mehdi,
Amazing.
amazing. That's simple, and the pen is gone, and I really love the name. How innovative! Great. So I think that there is still ACTIFAR to meet. They're really busy, but it's good. I mean, it's good that to see that they are very busy. Let's see. Because there are two people at ACTIFAR, maybe I can just... Oh, they're both busy. But actually, I just paid them a visit earlier today, and maybe you can also help me to understand the different products here. I think that here, the originality of their pregnancy test is that they don't use plastic. It's all made from sugar mills. So, yeah, I think it's just to show just what they use, maybe, because it's really the innovation of this company. It's the pregnancy test.
It's made from cellulose pulse.
Yeah, no plastic.
No plastic.
Yeah.
The idea. They are really focused on their environmental footprint.
Yeah.
And they want to propose solutions for feminine health that actually serve the patient but also serve the environment.
I just tried to express what we talked earlier today, but it's easier for Mehdi and I, Mehdi, come here, to have the word from you. So basically the originality of this pregnancy test is because it's not made of plastic, but it looks like, I mean, it's...
the quality is very impressive. It's important because this is a medical device, so people often think that what is eco is with less quality. So we choose really something that looks like, we can think it's plastic, but this is 100% recyclable.
So we can compost it.
And we can compost, of course, but it's better to recycle and give a second life to this. So that's why we just have to open it so we can sort, like we do in Belgium. Because here there is a small plastic, we cannot change. It's a medical device. It's only the cassette that change. So that's a big move, the first in 50 years for the pregnancy test. And we hope it would be the future for every kind of test, diagnostic.
Yeah, that's great innovation for disposable. I mean, such a waste to just put it in the bin. And actually, this is you also used the waste of the.
This is the waste of sugarcane. Yes. So this is the waste of sugarcane. It's easy to produce. We just cut, keep the garbage.
Where do you supply the?
In Asia, to be honest, because it's a big area to have sugarcane, so it's more efficient to produce that there.
Okay, this is for the pregnancy test, and the other one is the very high quality period panties. Hello. Hello, you there.
How are
you? You are too busy. I mean, we came here like twice or three times,
I
and
told you it will be easy to meet us,
but finally, you are here and you can answer my question. So we already had a talk with your colleague about for the pregnancy test, and still there is the panties.
Yes.
Maybe we can show. You can show some examples.
We have mainly since 7 years developed products, alternative products to avoid disposable products. This is the main target. This kind of product exists since a while, a long time in different countries. So it was not a good innovation. It was just putting on the market something that exists. But for European people, it's really complicated to find it at cheap price. You find it on the internet, but not in your supermarket or pharmacy. My job since 25 years is make it disposable for the people inside the shops, pharmacy, supermarket, and so on, at a correct price, because if it costs more than disposable products, people will not change. So since now 5 years, we developed 3 generations of products to make possible to reach the level of security and innovation that you have in the disposable products, because they are really secure. They made you really comfortable. So what is difficult to do is to do a product that has sense for the woman and that you can or use with some other protection or that you can use without other protections. So this was our target 7 years ago, and there is 2 brands who follow us and starts immediately. We were the first one in the supermarkets, mainly in France, and we did a real good job for that. Because when it's just near the products that are disposable, it's wonderful for the woman to have the choice. And test, they want to test. It's not too expensive, so they can try. This was the target.
So basically the product existed already a long time ago, but the innovation this year and the reason why you attend MEDICA is because you made a new innovation in the materials.
Yes, because we are here, but our customers know our product, so we have something to present if we don't have anything. But the cotton. If you look the cotton, it's not white, it's naturally brown. That means that in the field of the cotton is already brown. You don't need to dye it afterwards. That means that you don't use dye chemical products, and you don't need to wash the cotton to dye it. So you use 50% less water at the dyeing step, because you just need to wash it one time. If you dye it, you have to wash it between each chemical that you use before having a black tissue or black fiber.
And this means a lot of pollution.
This means a lot of pollution, and what is completely stupid is the countries where we use the most cotton colored is also the countries where you have the less water available for the people. Okay. So this is not compatible. It's stupid. Yeah.
Okay, great. So 2 great innovation and a very nice ecological approach, huh? Yeah, I mean, you don't feel like you don't feel like involved in the conversation, but this is important to understand the new innovation. Half of the global population that women are. Huh?
Yes.
Okay. So.
Yes, and there is something to do, because men taking care and say to women, "Oh, it's a risk. You have to be secure. Please buy our products. You will be." Everybody, the best way now is to change. Honestly speaking, it's not just go do what you do since 25 years, think differently.
Much, thank you. So Mehdi, are there other companies that we would like to pay a visit to? Because there are so many companies, but they are very busy, huh?
Exactly. I would like to go into something into more technological.
Okay.
And at the same time, really related to the experience of the user.
Okay.
Because when you are in the medical device industry, you need to make sure that it's effective, that it's secure, but also that it can be used the right way by the caregiver.
You stop here.
And I stop here. I would like to introduce you to iOS.
Hi, nice to meet you. So Mehdi already introduced a little the company, because it's a bit different from the other companies that we paid a visit to. Yes. So what is iOS Strategic Design doing?
So IOL is trying to do strategy, and it's already very strategic to be here, because indeed we are kind of isolated among some kind of people proposing some product. We are developers of products, so our purpose is really to receive some demand from potential customers here, and to try to provide them an answer to design new product. And the design could start from specific demand, ergonomic from users, from the market, but also to answer with some technical solutions. So being here for us is really strategic, because we are really along a lot of companies doing the production. And so it's a very easy way to create the connection between the demand and the production, and us being the kind of intermediary. So for us it's a right way to be efficient with 2 hats. The one to receive demand, and the hat to find some solutions.
I would like to see some examples, achievements. Is it possible?
It is. So here it's a medical fair, so therefore we present a lot of options in different products we are working on. We work a lot in medical application now for 15 years. We are active for 25 years, but for 15 years now we try really to focus in medical, because medical for us allow us to find some ergonomic solutions. So we work, for example, from diagnostic solutions, some solutions to help to relieve pain on the user, some kind of product you would see straight directly in a hospital by the user which is in contact, but also it could be a lot of machines which are at the background used in the lab, but all of them need to be ergonomic. And also using different kind of material. It could be made of plastic injection like that one. It could be made of sheet metal. It could be for very large production. It could be for very small production, few pieces, demonstrator and things like that. So it's many fields, many way of using the material and so.
Yeah, because here we only see a few images, but there are many more.
Oh yes, many more, because we all are also quite active in automotive. We are active in, well, if you see the coffee cup, even we designed them, by the way. But it was not the purpose to demonstrate them. So yes, we are active in plenty of fields. And what is very strategic for us, it's to be able to create link, which is something which is medical or not medical. And so we bring new solutions by mixing experience in different fields. So that helps also some people which mind to be open to other kind of way to produce, and we have in the background plenty of things which are really outside of that.
It's very challenging, huh?
Exactly, and actually in the medical device field, as I was saying, it's really important to at the same time meet the goal of the device, which is to treat the patient or to support it, and at the same time making sure that by the caregiver. A remote role that's been used in order to control the different elements in a proton therapy room that treat patients that are. This is directly used by the caregiver, so it's very important that it, at the same time, it's safe and effective and can actually meet the needs of the users.
And also the medical sector is very, I would say, apart from the other sectors, so it's really a field of expertise. So you basically you need to understand very well all kind of sectors expertise. So
yes, it's very busy.
You are the best.
Yeah, very expertise, and also one aspect which is quite important, that imagine you do plastic very specific by the injection and things like that, but also what is important for us sometimes is to find the subcontractor working in the country of our customers, and we try really to find the right technology, but also at the right place, at the right size of the market. So meeting plenty of them is highly important for us, and it's only what you can do if you take part to a fair like MEDICA, because it's directly wild. Much more interesting for us.
So being expert in many fields of companies, but also being multitask.
Yes.
So congratulations, that's quite impressive.
And you were asking me at the beginning of the live stream. It's still growing. I mean, we have many innovative companies in terms of medical products. Territory, and the good thing when you come to Wallonia and you can actually find the right partners.
Only designer. We could have integrated plenty of kind of engineers, but winners, and we don't want that. We want just to create some collaboration with outside engineers' offices, which would efficient in those different sectors. So we stay free. We could be the kind of creative element in a project, right person to receive. And for us, it's great that we are here on a small stand among those collaboration in a fair like this one.
And so again, you have this technical expertise and also this creativity and flexibility in order to be able to respond to the need of the customer and to really bring a solutions and not just another service, if I might say.
Very light, in fact. Big numbers to deal with, long-time development, and so being small is being very, very flexible, very, very reactive, small offer, moving together to the right answer, and so that's why we prefer to stay little, but having a lot of collaboration around us.
On the tablet, is it possible to see also other products that...
Yes, but I will ask
to... help! Because why I'm asking this is because I am sure that I'm convinced that we're not showing your code to everyone. I'm just quite convinced that we will probably recognize in our everyday life some of your design.
Yes, some or not, in fact. I'm not sure you will find that one because it's a kind of bioreactor culture of cells, and this is something just seen by engineers working and people working in the lab. That one, but this is not medical application. But that one is kind of light for the outside in any town. This is magic. It's kind of it's an element where the design is absolutely invisible, and it's a levitation object. So we designed something and the target is not to be seen. So it's to maintain some object in levitation in a box which is magic, and we help the customer to create the magic around that box.
So from medical to magic to the automotive.
Yes,
to the
here.
Box.
Yes, yes. Here it's maybe something you will see soon in some big hotel, very high-level hotel, to replace this Zoomex orange juicer and something a little bit more something innovative, very much inside. And we help to work in the ergonomic aspect by respecting some internal constraint, which has a compressor and so inside. But the outside is very minimalistic. Again, kind of levitation of the orange you will put inside the machine.
And how much time does it take to do the design? Because so many, I mean...
Yeah, time is flying, but I would say that a normal mission could be between 3 months if it's something very well constructed by the customer and he wants really an effective answer, and we can go quite quickly in the shape development technologically. And so this one, as an example, would be more 2 years, because at the beginning you need really to invent the service, the ergonomy of the service, and behind the ergonomy of the service you will create the object which will answer to that service. So that would be more 2 years, but few iteration of prototype, first demonstrator, prototypes, and then you move on step by step to reach the final shape and the final material. But so yes, being for 2 years, we prefer a project where we can really take the time, because the real expertise is to think about the service, the added value we bring to our product. Just answering by a shape, sometimes it's short for us. We like to create a concept to be strategic.
And so it also means that you have the capability to produce a prototype, proof of concept.
Yes, we do. We have quite a lot of printing machine. We have already a big library of components, and we play like we used to do when we were students. So we stay very much trying, instead of being behind a computer and imagining nice shapes, we go quite quickly in some real material to do some demonstrator. But after, we have also a lot of prototyping machine internally, but we have also a lot of subcontractor. We could help us to go straight to the right material, and we would need too many machines if we want to answer to any kind of specific demand we have. So again, it's a collaboration with the right people and to be effective.
So innovative.
Awesome,
Yeah,
yes.
that's very awesome. Very awesome. Thank you so much. So if there are companies that are watching us and they would like to leverage the quality of their design, or they already have an idea and they would like to...
It's important to have an idea, to think about also the market which will use it, and also not to invite us, but also not to invite us too late in the development, not trying to solve all the technical aspects before to meet us, because sometimes it's contre-productive in French. Yeah, because if you bring designer at the very beginning of a mission, you could be much more quickly creating shortcuts. And a shape, it's also a technical solution for the structure, and it could really reduce the cost of the final solution. And at the end, if you want to have a nice product, it's very important, but if you want to sell it, you need to reduce the cost. And integrating design at the very beginning is important. So bring the idea, what you need to create for your customer. You have to know very well your customer, and then we can start to talk together.
Understood. Thank you. Low battery.
Thank
you very much. Pleasure. Mehdi, are there other companies that we need to visit? No?
We already did a nice tour.
Yeah, and they are all very busy. They have client conversations. So, okay, thank you so much. Do you want to have the last words?
Yes, I'll try to be brief, but what's about Wallonia and medtech? Exactly, the Walloon government has invested a lot in the life sciences and is still investing in the sector. So, if you're a company abroad and you want to develop a project in Europe, I think it's worth to come and visit Wallonia. For the ecosystem, as we have seen, the ecosystem in pharma, biotech, in medtech, or even in radiopharma, you will find partners that can really help you in order to make your project succeed.
Because it's also one of the big missions of AWEX to attract new companies, and there are already very nice names in the medical sector here in Wallonia.
Exactly. One of the most known is GSK. It's Abbvie. It's a Belgian company. GSK. It's 9,000 employees working in R&D and production for vaccines and biologics. We were speaking of Abbvie, but in the nuclear medicine field, we have Telix. Telix is an Australian company who just opened their European radiopharma manufacturing facility. It's actually one of the largest in Europe. In cell and gene therapy, so it's really advanced therapy in biotech. We have Catalent, who has opened a couple of years ago the European Center for Cell and Gene Therapy Production. And we have many other names like that. And the fact also that the government is trying to support all this investment initiative by providing investment grants. If you do R&D, by providing incentives for R&D, and with very favorable tax measures on salaries, but also on benefits. And finally, and maybe the main reason is that when you're in Belgium, Wallonia, you're in the heart in Europe. Actually, 1/3 of the market is accessible in only 6 hours.
Okay.
And exactly. So that's why we are such an important exporter of life sciences product. And on top of that, we have 2 CE pharma certified airport, Brussels and Liège.
That many reasons.
Exactly.
So if you are a foreign company, you would like to find the right place to grow your business in Europe, choose Wallonia. So many reasons you mentioned. Okay, so we paid a visit to a lot of different companies here, but there are many more. So if you are just around in other hall of MEDICA, come and pay a visit to the Walloon pavilion. I'm sure that it's worth it. And if it's not yet done, don't hesitate to subscribe to the AWEX social medias. It's full of information and great opportunities and information to know. So thank you so much and bye-bye. Thank you, Mehdi.